Well, hello, everyone. Good evening. Welcome to the ASI Hour. This week is our health track and health evangelism. So I'm James Hartley. I've been organizing this week. Last week we had, I think, Pastor Bradshaw on evangelism. This week we have Rodney Bowes, and he'll be talking about community health evangelism, some practical ways to use the right arm of the gospel in your communities. So I'm really glad. Thank you, Rodney, for being with us. I've had the privilege of working with Rodney for a number of years, and he's got plenty of experience with his leadership in HER, Health Education Resources. He's the president for that organization, and he and I have worked with Light Ministry for the past 12 years now, I guess.
Is it already 12 years, James?
Yeah.
Wow.
Yeah. Going on more. So, well, we're glad to have everyone. We see a good group here assembling. So just a few pointers here. There's the chat on the right. A lot of you are probably repeat attendees here. You know how it works. The chat, you can make comments during the presentation. You can ask questions, and then Rodney's going to leave a little time at the end to go over those questions. We also have some poll questions there that you can answer, and we kind of see how everybody's answering them live on the go. So we're really glad that you all are here. We're trying to want to make it interactive. And there will also be handouts. So if you want to get the presentation that's going to be shared, you don't have to try to write down every reference. Rodney has made that available, so we'll make that available here momentarily. And you know what? Maybe before we have the prayer, we can do this first poll question for those that are signing in here, and that is where is everybody joining us from? Usually we've been doing time zones. We thought we'd do something a little bit different. See if there's anybody else out there from Central South America. Looks like we have one from Asia, one from Africa. Welcome to those. We're mostly North America. We've had a sprinkling of time zones, so we're grateful to see that. We just thought as an experiment here to see where everyone else is coming from. So one from Central or South America. Maybe that also includes the islands. So if you're calling from the Caribbean, you could maybe choose that one as well. Okay, well, we're a large. There we go. We got one more from Asia. So different time zones. For those in Asia, it is now Friday morning. So good morning to you all, and thank you everyone again for being here. So we're gonna get back into. Let me get back to those other questions. So, all right. So I'm gonna have just a word of prayer for Rodney. Turn it over to him. He's gonna be sharing again community health evangelism. So let's bow our heads, ask for God's blessing. Father, thank you so much for the technology that we can have such a group from across the U.S. and even some from around the world. We're glad to have Rodney with us tonight to share some of the experiences he's had here in the U.S. and from a lot of his travels, different cultures, using the right arm of the gospel. Bless him as he shares tonight. We pray everything would go well with our technology, internet. Glad for this chance and glad for the blessing of this ASI hour that we can be fellowshipping throughout the year. So we just pray that you'll bless us now, and we thank you in Jesus' name. Amen.
Amen. Thank you so much.
Sure,
appreciate that. It's truly a blessing that we can join together and talk about one of my favorite subjects, which is health outreach. I am convinced that we are at a time that we must be doing health outreach, or our churches will literally cease to exist. So I want to bring up another poll question. The second one, we want to ask you, how important do you believe the health message is in sharing the gospel? Are you convinced? Do you think it's not important at all, slightly important, or very important? All right. I'm seeing that we have 100%. Fantastic. Just what I was hoping to see. So the next one, just so I get to know the audience a little bit better, why don't we bring up number 3 here, poll number 3, which is, Are you a health professional?
Okay.
We want to see where we're at. Okay, good. We have a nice group. I'm going to be sharing several things here this evening that are applicable to all of you. There is some wonderful opportunities for those of you who are health professionals. There are some incredible things that we have been doing over the past several years that now are more important than ever. For those of you who are not health professionals, I hope that you are convinced that you have a part to play, and we're going to put some tools in your hands that are going to be a blessing to you as well. I'm going to share my presentation at this point, and as James mentioned, this presentation is going to be available to you as a PowerPoint presentation. You can edit it, and my desire and my hope is that you will be so inspired that you're going to repeat the presentation, and it will have a ripple effect, and we will have churches that are active and vibrant, promoting health ministry and promoting the three angels messages, because really that's what it's all about. When it comes down to it, that is what we should be doing with our health outreach. That is the end goal of where we are headed. So I'd like for you to notice this. What is health evangelism? It is not just health education, and it is not just sharing Bible prophecies. It is the blending of these. And just like Jesus showed us, we see in Matthew chapter 4, if you've been with us in the health track here at ASI Hour, there are some key verses that keep coming up. We're going to look at it again. In Matthew chapter 4, verse 23 and 24, we see clearly that it says that Jesus had three important points in his ministry. It says Jesus went about all Galilee, teaching in their synagogues and preaching the gospel of the kingdom and healing all manner of sickness and all manner of disease among the people. And as we continue thinking about this in ministry of healing, we find out very clearly it says that during his ministry, Jesus devoted more time to healing the sick than to preaching. Now, I don't know about you, but the world is right now in two crises. Number one is COVID-19. And yes, it is a serious thing. We've recently had several personal friends in our church who have passed away from the coronavirus. My wife's parents both got coronavirus and, praise the Lord, recovered. But I have several friends who are physicians, and they have seen that there is a surge that is going on in lifestyle-related diseases because people are now afraid to go out. They're afraid to go to their doctor. They're afraid to get counsel. So they are sitting home with diabetes, and it's out of control. And we need to do something to help them. There are people with high blood pressure, with heart disease, with different chronic illnesses that they need help. And we have the tools to help them. Every one of us can do something to help these people. We need to understand that this commission that Jesus gives is something for everyone. We see the 12 disciples when they went out in Luke chapter 9, verse 1, it tells us that Jesus gave authority. He gave them power and authority over all devils and to cure diseases. He sent them to preach the gospel and to heal the sick. As we continue looking at the circle of influence that health evangelism is supposed to have, we see the 70 who were sent out 2 by 2. I'm going to tell you a story because our church recently did an outreach project. Actually, just this last Sabbath, we went out 2 by 2 and we had a great time. I'll tell you more about it in just a moment. But Jesus sent out those 70 disciples. Luke chapter 10, verse 9 says that they were to do the same thing as Jesus, healing the sick and saying to them, or preaching or teaching, the kingdom of God is come nigh unto you. In Mark chapter 16, the great gospel commission, where we find the parallel to Matthew 28, we see that the work of the church, of God's people, of you and me, is to go into all the world and preach the gospel to every creature. That is, we know as Seventh-day Adventists, the everlasting gospel, the three angels' messages. By the way, that just reminded me, I want to give each of you an invitation. If you have not yet signed up for ASI's new evangelistic initiative, 3 a.m. call, I want to invite you to do that tonight for sure. We have resources, tools that are ready to go. You'll be sharing the gospel of Jesus even today if you will sign up at the 3amcall.org. But notice what it goes on to say in Mark chapter 16. At the end of verse 18, we're going to go right to the bottom of this slide. It said, they shall lay hands on the sick and they shall recover. I believe in supernatural healings. Definitely. I've traveled around the world, been a missionary. I've prayed with people. I've seen amazing recoveries that science cannot explain that are just incredible. But the major miracle that God is doing today is through lifestyle change. The simple little changes that people can make in their lifestyle have a huge effect and bring supernatural results. It's no wonder that Ellen White said that we find in Testimonies for the Church, volume 7, page 62, we have come to a time when every member of the church should take hold of medical missionary work. And I am so excited that you believe that medical missionary work or health evangelism is important in sharing the gospel. So at this time, James, would you bring up the next poll? It's number 4. I want to know, is your church currently doing health outreach? I'm very curious. Is your church currently doing health outreach? The reason I'm so curious is because I live in Southern California and many of our churches are still closed. And unfortunately, a lot of our ministries are closed also. And I think that is something that we all should change. My goal is to convince you by the end of this presentation that all of you who answered no are going to switch to the other side. And your church is going to be doing health outreach beginning this weekend. There is a resource available for everyone. It's specifically targeted for North America, but everyone can be a part of it. So I'm going to share that with you in just a moment. But thank you very much. We only have 72% of our audience. Those of you watching, are you really watching? I want to encourage you. Please answer the poll here so we can know exactly what is happening. Just let us know. Is your church actively involved in doing health outreach? Thank you very much, everyone, for your participation. I want to share a few more things before I get into some practical nuts and bolts. And again, if you've just joined us, this presentation is going to be available to you. At the end, we're going to make it as a handout. You're going to be able to download it. You're going to be able to share it with others. Notice what it says in medical ministry. The gospel of health is to be firmly linked with the ministry of the word. This is a very important key, especially for the health professionals who are watching. What I have seen so often is that health is not linked with the ministry of the word. They're independent on either sides of the spectrum, and we're hoping that they will be joined together. It is the Lord's design that the restoring influence of health reform shall be a part of the last great effort to proclaim the gospel message. Councils on Health. God has shown that health reform is as closely connected with the third angel's message as the hand is with the body. In other words, it is inextricably linked together. You cannot separate them. They should go together. That is God's plan. Medical ministry, very solemn thought. When the gospel ministers and the medical missionary workers are not united, there is placed in our churches the worst evil that can be placed there. That's a serious and very solemn statement. So the main point, we need to work together, and the message of the gospel needs to be connected very closely with the medical missionary or the health evangelism work that we do. The medical missionary work should be a part of how many churches in our land? I can hear you. Every church in our land. Disconnected from the church, it would soon become a strange medley of disorganized atoms. It would consume, not produce. There is so much in this statement. I could spend the whole rest of the time, but it's already going so fast. 15 minutes already gone. Medical missionary work is to be organized. It is to come through the church. The church is the organ that it's supposed to come from. And when it's connected with the church, there is a power that is there. I teach a class on the principles of health and healing. And in that class, we talk about the counterfeit to the right arm. It's the New Age movement. And we see it everywhere. I mean, there are so many people who are interested in health, but this quote is so true. If I look at it, it's almost laughable at times because it is so disorganized. There's conflicting views. There's this product versus this product and this theory versus that one. God's plan is so beautiful. If we stick to the basics, we are guaranteed success. This one here. If people see that we are intelligent with regard to health, they will be more ready to believe that we are sound in Bible doctrines. I love that. And by God's grace, we are intelligent in regard to health. We have been given an amazing amount of information. So for those of you who are in the health professional world, I want you to look very carefully at this. Doctors, nurses, physical therapists, massage therapists, dietitians, those in professional healthcare setting of any kind can be very intentional in making the bridge between physical health and spiritual health. I realize that a lot of medicine that's being done right now in our world is telemedicine. I have, like I said, many friends who work at Loma Linda and other hospitals around Southern California, and a lot of them are spending time just like we're doing right now. I don't know exactly how you can, do a physical assessment without doing a physical assessment, but that's the reality of the world that we live in. And yes, there are clinics that are open as well. And I'll tell you that people are craving a personal touch. And research has shown that people want their doctor, they want their healthcare provider to actually be involved in their spiritual life. I read several research articles actually on that very subject, and it astounded me just to see how open people are and how much they are craving for something more than just, you have high blood pressure and you should take this medication, and thank you for your time. I'll see you in 3 weeks, or we'll follow up in a month, whatever the case is. People are craving for a connection between their physical and their spiritual health. How do we do that? We're going to talk a little bit, and I'm going to show you some very practical tools that you can use to do that in your professional setting. But notice this. This is a shocking statement. Medical ministry. The purpose of our health institutions is not first and foremost to be that of hospitals. The health institutions connected with the closing work of the gospel in the earth stand for the great principles of the gospel in all its fullness. Christ is the one to be revealed in all the institutions connected with the closing work. But none of them can do it so fully as the health institution, where the sick and suffering come for relief and deliverance from both physical and spiritual ailment. Many of those in need, like the paralytic of old, the forgiveness of sin, the first thing, and they need to learn how to go and sin no more. I love God's plan. God's plan is for those who are on the front lines of the professional health world to be gospel missionaries, sharing the good news of Jesus Christ with their patients. Review and Herald October 29, 1914. If a sanitarium, I'd like to put in there, if a hospital, if a clinic, if a whatever physical therapy facility, if a whatever connected with the closing message fails to lift up Christ and the principles of the gospel as developed in the third angel's message, it fails in its most important feature and contradicts the very object of its existence. Is that food for thought? That's an amazing statement. We need to be ever so careful that we are following God's plan. So what are some things that you can do even right now? Praying with patience. Dr. Brian Schwartz has been on with us on our ASI programs in many different realms. Great seminars on praying with patience. If you're not in the habit of doing this, start today, tonight, wherever you are, start now. The next thing is having Bible studies in the hospital or the clinic. As I mentioned, I recognize that many of these facilities are closed or have restricted times and all other restrictions that are binding them, but we can do it online. And yes, do what you can. The same goes with small groups. If you live in a temperate climate where, like I do in California, the weather is still quite nice. We can have outdoor gatherings. We're having outdoor church right now. We can have outdoor small groups where people are following whatever the local jurisdiction is for the different restrictions that we have. But small groups are fantastic and they continue to work. And then combining health and spiritual topics in seminars and counseling. And as I mentioned, we're going to have some resources that will show you or enable you to combine those things naturally. It's not going to be a hard thing. Have media in waiting rooms. Just the other day, my parents had an appointment at Loma Linda. I want to show you what is happening at Loma Linda. It's very encouraging, and maybe you'll get an idea to do something similar at your place, in your community. If there is a Seventh-day Adventist institution, this is a must. Every Seventh-day Adventist institution needs something like this. If you are just a believer in the three angels' messages and you want to spread the good news, go to your local healthcare provider and ask, can I put up a little literature rack, something similar to this? If you zoom in, when you get this presentation, you zoom in, you'll see that we have full message books there. Desire of Ages is right there. Study guide from It Is Written is there. Ministry of Healing is there. Steps to Christ is there. It's a blend. People come to our health institutions from all different walks of life. They must be given an opportunity as the Holy Spirit is working on them. Literature is so very important. There's a good friend of ours at ASI, Paul DeMazzo, who's worked for decades in ASI and ASI's ministry and vision. He's showing what one of those little racks could look like. It Is Written study guide, Voice of Prophecy study guides right there. Just inviting people to study the Bible and engage. And then if you have someone who can go and meet the people in the waiting rooms, what a great thing that could happen. Here's something else that we would like to share with you. I'm the president of Health Education Resources, and we've developed a banner. It's the 10 Laws of Health. You might be saying, what are the 10 Laws of Health? Well, we added a couple of extra ones because of the crisis. Many of you are very familiar with the New Start principles. We added 2 more, attitude, because so many people are really needing some help with their attitude and lifting depression. They've been isolated for so long. So this poster is available from Health Education Resources. I'll put the website in just a moment. And then the 10th principle is cleanliness. So that's something that you can put up right there in your waiting room, in your whatever you have where people gather. This is a great thing. It comes in many different sizes and varieties of ways to mount it on the wall. More permanent or something very simple and you can move around. We also have that in a poster size that you can get. A fantastic opportunity to share the either 8 laws of health or 10 laws. We have 2 different posters for that. Then there is media. We need to have good quality media in our waiting rooms. This is something that is a great need, and there are a few sources that have beautiful hymns. They're catchy. They don't have words, with beautiful landscapes from all around the world. Fantastic opportunity. Let's talk now about those who are non-medical. First of all, I want to understand that we are the majority. I'm not a medical doctor in a professional medical setting, but I'm convinced that I am called to take hold of medical missionary work. So as we saw from poll number 4, the majority of us here tonight, or poll number 3, are not medical professionals. And it says, but few can take a course of training in our medical institutions, but all can study our health literature and become intelligent on this important subject. So I want to bring up our next poll. Poll number 5. Poll number 5 says, have you taken a health evangelism or medical missionary course before? Poll number 5 should be coming right up for us. Poll number 5. See if we can get that live. We want to encourage you. There's the poll. Thank you so much. We want to see where you are in your experience with these kind of courses and share with you some things. Thank you very much. Keep answering. Those who are watching, we have a good number of people watching here tonight. Let's get it close to 100% interaction. If you are driving, you are excused from answering the poll question. We don't want to be the cause of any accidents, but hopefully we can get it a little closer to 100%. But we see here quite a bit of a split, 43-57. So I would like to encourage you, those of you who answered no, which is on the greater side, the majority here tonight, if you've not taken a health evangelism course, a medical missionary course, you need to take one. They are so good. Even if you're a health professional, I will guarantee you that you will learn something in this course that will bless you in your ministry to the world. And if you're, again, non-medical, these courses are great because they lay the foundation. Everyone can understand the simple basics of the health message and even some more challenging things in that. And that's what you'll find out if you take one of these courses. And as mentioned, I work with my good friend James at Light Ministry, and we have developed a fantastic health evangelism course. We want to invite you to look at that. I'll put the website up in just a moment. Most of the diseases today are lifestyle related, and we can all become intelligent in regard to helping others. So even starting today, starting right now, when's the last time that you read Ministry of Healing? If your answer is anything over 1 month ago, you need to pick up that book again. This is the blueprint. This is the textbook for authentic, true medical missionary work, Ministry of Healing. I have, over the course of years, talked to several different doctors who have, after some time, they got tired of the routine medicine, is what they called it. When they talked to me, they said, we were tired of that. We wanted to do something more fulfilling. And they said the one thing that was so pivotal in their practice was just to follow Ministry of Healing and then to share it with their church members We've done this at our local church. We started a Sabbath school studying the ministry of healing. It's a great book. Testimonies for the Church, Counsels on Health, Call to Medical Evangelism. Tremendous resource that I like to encourage people to get is the Natural Remedies Encyclopedia by Dr. Agatha Thrash. Fantastic book. And then there are several medical missionary training courses that are available. But again, I want to encourage you, if you're not familiar with Light Ministry, please become familiar with us. We have a free course on the 3 a.m. call that you can take. It's just 2 hours introduction. You'll really enjoy it, I guarantee it. And then if you want more, you can take one of our longer courses. If you just go to our website, lightingtheworld.org, which I'm going to put on the screen. I think it's my next slide. But when you get there, you just click on training. And the training is online. And it is truly a fantastic training. There is the website, lightingtheworld.org. So I hope and pray that you can join the more than 30,000 people who have taken a light training course around the world. We've worked very closely with the Seventh-day Adventist Church. We have good friends at the General Conference Health Ministries Department that have looked at our material and said, it's great, please share it far and wide. And so we want to just encourage you to be part of the Light family, lightingtheworld.org. Now, what are some outreach activities that we can do in this time? I realize that there are some places where the restrictions that we are under right now are very tight. But other places where I talk to my friends and colleagues, it's not so bad. I mean, they're really able to do quite a bit. So I hope that you can gather something from this wherever you are watching from. Now, the Health Expo, this is, this has been like the go-to event in times past. But I recognize that at this current time, doing a full Health Expo is virtually impossible. But maybe you can do it virtually. We're still working on something that you can do that. But I want to just encourage you that as things open up, I guarantee you that there will be tremendous interest in health. And so I want you to be thinking about what you can do publicly in the community as your community opens up to allow you to do something like that. Here's an article that was in the Pacific Union Recorder, our paper out here on the West Coast, talking about one of our teams that did this event inside Walmart, a health screening inside Walmart. What a fantastic thing. Just get some Health Expo banners, put them up behind you, and, do whatever you possibly can to share literature, encouraging words. We're not going to have a lot of physical contact, obviously, but certainly with creativity, we can find something. We have a full manual for the Health Expo that is available. There are 2 different sets that are available as well. We have ones that have a lot of faces on them, the 16 banner set, and then the 8 banner set that's also available that highlights the principles of health. We need to get these out into the public setting as much as possible. But here's something that I really believe can be very important right now. Our little school at our church, our local church in Mentone, California, just opened up for in-person classes. And I believe it's a wonderful opportunity for us to do a children's health expo. I think we can do these in our own Seventh-day Adventist schools as well as in public schools in our community. The Children's Health Expo is really fun. It's got a lot of interactive games. We have a full manual that you can download. It's got templates. You can laminate these things, and the kids can have a blast as they are learning about nutrition and exercise and water and sunshine and the 10 natural remedies or the 8, whatever you choose to do. But it can be very engaging. And all of that is available at healthexporesources.com. That's healthexporesources.com. So we invite you to go to that website and see what material we have there. Now, here's the thing that I was telling you about. I said that there's something that everyone can do to start doing community health outreach this very week. Did you know that this coming Sabbath, September 19, 2020, is Made to Move Sabbath? So whether your church is meeting outside or you're online, everyone can be involved in Made to Move. It's from the North American Division. My friend Angie is the director of the North American Division Health Ministries Department, and she is teamed up with some of our friends also at F5 Challenge to have some really engaging exercise, group exercise, if you are able to pull it off. Again, the videos are available. Let me show you what they're. First, Made to Move Sabbath is, again, September 19. You just need to go to the, you can see the website there, nadhealth.org. And there's a sermon that you can share if you want to prepare that and share it online, or if you're able to share it at your church, that's totally fine. But Made to Move Sabbath is coming right up, presented by a good friend of ours, friend of ASI and GYC, Sebastian Braxton, wrote the script for the sermon. So I know that you'll really enjoy it. And then there are 8 days. There is the Sabbath, and then 7 days of fitness and devotion. That's exactly right. It's a combination of a intensive, well, it can be as intense as you personally want to make it. If you go to the website, there's some nice downloadable things that you fill out, shows you exactly how to do certain exercises. Then it has an idea, I'll show you on the next slide, for a group activity. And this would be a great thing for you to do with your church members and then open it up to the community. There's a lot of people, I think, that would really enjoy this Made to Move challenge. And here's the idea of something you can do. A welcome, you do 3 to 5 minutes where you play the exercise video, then you do the exercise test for our local church. Our members are so busy, I'm going to make a special video for them and just say you watch it whenever you can throughout the day. And then we'll get back together in the evening just for 30 minutes. We'll watch a devotional video, and then we'll have a little group Bible study together. So that's the idea of Made to Move. I hope that you are inspired with that. Then there's another one that has been really successful over the years. It is Dinner with the Doctor. Do you notice this picture? These people are outside. They're eating. I think we should be creative. We should think about how can we do this kind of thing? How can we get into our communities and have dinner with the doctor? Certainly, this pandemic should not stifle us. We should be thinking of creative ways that we can get out into the community and meet with people. Here's a picture of what they did in Florida. There is a huge amount of money that is being invested in outdoor health equipment. Start a community health club outside, and it can be a fantastic thing. Or online, an online community health club. Do a Facebook group. Do a WhatsApp group. There are many other social media platforms as well that can help us to get involved in community health outreach. So I want to talk a little bit here. We have about 10 minutes before we open it up for our questions. By the way, if you have a question that's come to your mind, feel free just to put it in the chat box. James is going to go through them, and we're going to have a time of question and answer in about 10 minutes. So start typing your questions in there. Door-to-door work. And you might be saying, door-to-door work in the middle of a pandemic? Should we do something like that? The answer is yes, we should do something like that. So what we did at our local church is we ordered 5,000 booklets that are called On the Edge of Time. At this time, it is my favorite outreach book because it is the great controversy It is 10 chapters of the Great Controversy that are very powerful. This little booklet is available from our friends at Project Steps to Christ, and you can order them by the pallet load, which I encourage you to do. Then we got, oh, by the way, in the book, what I really like about this little book is that it's full color all the way through, and it's got QR codes. If you're not familiar with the QR code, it's a nice little code on the page. You just use your smartphone, hold it over the QR code, and it opens a website for you. Not only that, but it has an opportunity to get Taj Paklib's evangelistic sermons mailed to you, or mailed to whoever you might want them to be mailed to. All available in that little book with multiple opportunities to ask for Bible study. So what we did is we took our community and we opened up Google Maps. Praise the Lord for Google Maps. We divided our territory into an area where each person would have about 50 homes. We found out that that was actually too little. We needed more like 100 homes. So we had a time where church members were invited to come and assemble gift bags. We just got some clear bags that you could hang on the door from Uline. That's where we purchased them from. Then we stuck the booklet in there. And also you can see in this picture, do you see I photoshopped in here? It's not an actual one, but I put coronavirus tract from Glow Ministry. By the way, they are at a very good price right now. I think they're only available in California and Michigan. But anyways, the coronavirus tract from Glow, we took those, we put that in together with the booklet On the Edge of Time, and we went out 2 by 2 in our community. It was so fun. We had older people, we had younger people, teenagers, and even younger than that, I think, that were going out. Our pastor was involved, and we gave the maps. We said, this is your territory. Go out and enjoy. So let me tell you a testimony of what happened as we were going out door to door. I'll tell you the story of Robert. So as we were going to this particular street, we turned the corner and Robert was there flying his drone. And he was having a nice time out in his front lawn. And he was just flying his drone, and it crashed. A perfect opportunity to walk up and start a little conversation with him. We had a wonderful little chat, found out that he was raised in the Mormon faith, but he was very interested in talking. I have a shirt that says Seventh-day Adventist on it, so I wasn't hiding who I was with. And he says, oh yeah, I have a lot of friends who are Seventh-day Adventists. We had a great chat together, talked about his family. They were stuck in New Zealand at the current time. We asked if we could pray with him. We had a beautiful prayer. He prayed for us. We prayed for him. Built some really good, positive communication. And then we gave him the book actually earlier on. He again said, thank you very much for this. He had the book and a glow tract on health. Powerful, powerful time. We're going to do it again. We are planning, our goal is to pass out at least 1,000 books per week when we do this. And we're going to do it once a month. But actually, like I told you, we'll probably do 2,000 because 50 homes was just so fast. By the way, we did not engage and knock on people's doors for, some people might be afraid. We just left it on their door and went to the next house. But it was a great way to get our church members involved in doing outreach. Then there is mailings. Again, something I would encourage every church to do. Just talk to Pacific Press, AdventistBookCenter.com, I think it is. And for those of you here in North America, you can get this magazine and you can mail it to every home in a certain zip code. Not just a zip code. If you live in a highly populated metropolitan area where there's thousands and thousands of homes, you can break it down to just the carrier route. And I encourage you, this is a great resource by Pastor Mark Finley and our friends here at ASI. Andy and her husband also had something included in this. It's an excellent resource. I encourage every church to get involved in doing a mailing. Another thing that I would like to encourage you to do, along with your mailing of this, you need to be very involved in doing Facebook advertising. And again, Project Steps to Christ has had a phenomenal success rate in what they're doing. It's a wonderful opportunity to go and meet people and personally deliver literature. I told you about On the Edge of Time. Our church is doing a Facebook campaign. Every day we are spending just a little bit of money and putting out a little ad for people to request On the Edge of Time. In just 1 month, we have had 120 leads, and we're trying to follow up on those personally. It's a great opportunity. People are hungry for the gospel. They are looking for truth. It's a time that we can be at the forefront of community health evangelism. Again, God is working in amazing, amazing ways. Then I want to tell you about Light Up Your Life. This is a little booklet that we developed at Light. You can actually order it from us at the website, lightingtheworld.org. Fantastic resource to do some personal coaching with people, one-on-one, taking people through 7 different health habits. It's a journey of several weeks, 7 weeks, and it goes through day by day, helping people make little changes in their lifestyle. And over the course of this time, obviously, you can develop a great friendship with people and just really enjoy getting to know them. This is something that can be done, like I said, door to door. You can go out door to door and do this. You can also try to do it virtually if you have a little bit of tech savvy people around you, or maybe you're a tech savvy person yourself right now watching tonight or today. You can do a Facebook campaign. And again, a fantastic way to get involved. So my last slide that I'm going to put up here as we finish, for any health outreach, we want to make it sustainable. So we encourage you to make a plan. Make a plan as your health ministry leader team or your whole church. Actually, that's the real goal, is that your whole church should continue to have a strong evangelistic plan, not hiding now, but being very aggressive in our search for souls who are looking wistfully toward heaven. Develop a team. I guarantee you that there are many people who are waiting to get involved. Just last week, we created a whole bunch of new positions for ministry. We have all these books. There are people with no soliciting signs. We found out that, I've done a lot of call porter work. I've knocked on a lot of doors. I've been chased by dogs. I've been, kicked off porches, whatever the case is. No soliciting signs in the past have not been a big issue for me. But in our current environment, especially where we are, we said, what we're going to do is we're going to respect these people's no soliciting signs. We're going to write down their address and we're going to mail them a book instead. So that's what we did. And we created a whole lot of work for 2 people. Now they're very active, addressing the envelopes, putting the booklets in there, and sending them out. And of course, number 3 is make your plan financially sound. There are many ways that you're able to do this. Many people are still looking for ways they can contribute to their community, and just dream big. God will bless your efforts. I know that he definitely will. So I want to put this last poll question up. Then we are going to our Q&A. So can we have poll question number 6 up this evening.
Sure, number
poll
6
question number 6
right here.
is, are you committed? Perfect. Thank you so much, James. Are you committed to doing something more in your community starting today? Has this presentation compelled you to action? I hope and pray that it has. Thank you for your honesty. Those who said no, that's all right. We're going to, as you're answering this, we have 50%. Come on, everyone. We know that you're still with us, so please continue to answer that for us. James, why don't you also put the handout? Can you make that available for people to download as well?
Yeah, sure. No problem.
And then we'll go into our Q&A. That's great. Thank you so much for that. Appreciate that.
So Rodney, thank you so much.
Okay.
Yeah, you've covered a lot of ground. There was just a few questions up here. One was an interesting one. It was, do you have any specific strategies to engage people that have disabilities? Any health outreach strategies, especially for those that are disabled?
Well, the last one that I mentioned actually would be perfect. You know, those who might be disabled, it depends on disability, of course. I don't know exactly what disability you might be referring to, but you know, if someone is wheelchair bound, let's say, they can certainly still stuff envelopes. They can put labels on things, like in the community mailing. If that answers the question, I hope it does. But there are many things. We just need to be creative and thoughtful, and we can engage people of all different levels and physical capabilities.
And I was thinking maybe also just the door-to-door ministry. If we know someone's shut in, they're not able to get out, maybe they're in a wheelchair, or they need some sort of help, you know, just that ministry to reach out.
Now, if it's on the other side of the question, that's right, James. I mean, you know, our churches have shut-ins, and it's a tremendous ministry. Something that I have encouraged and we've done for several of our members is do a meal train. If you're not familiar with meal train, just go to your favorite search engine, type in meal train, and you can create a meal train for someone. If they're, you know, for whatever reason, if they need something, if they're infirmed, if they're disabled, you can create something and bring them the health message right to their doorstep through that way. And our young people at church, you know, our youth pastor has regular community service. They put on their masks and they go out into the community, mow people's lawns, do grocery shopping for people. You know, everyone's painting their house, right? Have you seen that? During this time, everyone's at home with some project. So there's a lot we can be doing, for sure. Excellent question.
You mentioned briefly about health clubs. Maybe you could kind of give a little bit of more of a detail on how would someone listening here get a health club started at their church?
Well, they would take the light training course, and we would take them step by step for 1 hour on how to develop a health club. But in 2 minutes or 3 minutes, step number 1 is if you're wanting to start a health club, start with this Made to Move week from the North American division. It would be a fantastic opportunity. There's already a lot of advertising material. There's a little plan that's actually made for you, exactly what to do, how to encourage people to have fitness and devotion. So, you know, a true Seventh-day Adventist health club is going to have a few key components. Number 1 is it is going to emphasize the 8 natural remedies that we know so well, the New Start program, right? Let's just say it that way. But it's also going to have a strong emphasis on spirituality. And so this little program can give you a kickstart. And then what you can do is you just develop a team. And again, this could be online or it could be an in-person club, but you just develop your schedule and you say, hey, we're going to meet once a week. We're going to meet once a month, whatever it is. Just be consistent, get together, have a little plan, just a rough outline of an introduction, an exciting or an informational speaker. And there are so many. If you want to email me, I'll give you a list of resources that you can play videos. ASI has the Abundant Living Health Talks that ASI has on our website at asiministries.org. And you can give your own health talk. And the key is just to keep it going. That's really the key. Just to get people out and then encourage them. Send text messages. Hey, we're having our club meeting tomorrow. Please come and join us.
Yeah.
Any other thoughts, James? I know you've got a great community club there in Wildwood area.
Yeah, that's growing. We have a couple. We have 3 different locations because of our involvement with our students who are working different parts of the town. Maybe one of the questions that I find even people with experience in health evangelism struggle with is how to bridge into the spiritual. So we're at a cooking class or a health club meeting or an event, and we're making friends with people, but like, how do we get over into talking spiritual things?
Oh, fantastic. Okay, so on this one, step number 1 is you take our course on the 3 a.m. call website, and it's called Making Disciples 101. Pastor Jim Howard and Cameron DeVasher have some amazing material that walk you through how you can make a conversation spiritual. And you just have to practice. That's all I can say. I mean, there's no magic thing that like you say it with everyone, right? Every person's a little different. They interact differently. But there are some key phrases that you can use while you are speaking. And obviously, you know, if you're doing it at a church or if people know that it's coming from a church setting, just do it. Just pray. Just ask people if they want to study the Bible. Have literature there. Have Bible study cards on every brochure that you are going to pass out or on your survey. Are you interested in Bible study? I mean, don't hide it. That's right. Key number 1. Just make it available and then talk about it whenever it's natural. And it will become more natural the more you do it.
We're too shy, you know, to just be open and a little bit more direct. But you got to measure the person, I guess. Well, just one real short thing that I've kind of used just in conversation is just talking about New Start. New Start's kind of a great bridge because you can walk yourself through the 8 laws of health and then you finish with the spiritual. It's like, well, you know, spiritual health is so tied with the physical health, and you just start talking about spiritual things, you know, that way in a lecture or one-on-one, and you know, who knows what doors will open up from there.
Yeah, so, that's right. Perfect.
We're about out of time, Rodney. We really want to thank you for sharing all these ideas. I'm going to listen to those messages because there's always more to learn and more to improve on the spiritual connection. I hadn't heard of those lectures on the 3 a.m. call, so I'm going to check that out. Thank you for sharing that. Next week I
will tell you. Let me just make. Sorry, James, but. I'm really excited. For those of you who are watching who know Audioverse, you know that Audioverse used to have courses. They used to develop those, but they're no longer doing that. And so we at ASI are going to take those courses on personal evangelism. These are in-depth courses. These are not just like, you know, 10-minute lecture and you're done. These are serious training courses. Those are going to be available very soon at the 3 a.m. call. So I just want to encourage everyone who watches this video, make sure that you're connected with us there.
Excellent.
Thanks, James.
Thank you, Rodney. So next week we'll be on ministry for the ASI Hour. We'll have Pastor Stephen Gravener. He's the president of OCI, Outpost Centers International. And so he'll be sharing with Jesse Zwicker, who is the Vice President of Development for OCI, and they'll be sharing more advice particular to ministry. So thanks everyone for being here every Thursday night at this hour. It was a blessing. I hope you enjoyed it. Make sure you get that download. If you missed anything, just reach out to us. Just going to have a short prayer and ask for God's blessing. Father, thank you so much for the time that we could spend together here. Thank you for all the ideas that Rodney shared with us. Help us, Lord, to learn how to use the right arm of the gospel in a way that will reach people and point them to Jesus. Thank you so much for this blessing. Help us to also take care of our own health so that we can be lights in the world and be connected with you so that we can point people to Jesus. And pray for Rodney and the ministries he's involved with and everyone listening. Help us all, Lord, to be able to learn what more we could do in our communities, helping people in practical ways so we can reach their heart and point them to our Lord. And we thank you and offer these prayers in Jesus' name. Amen. Thank you, everyone. God bless. Bye-bye.